Hello, I'm Weiss, a cardiologist with U of L Health, who's been practicing in this community for a number of years. My father was a physician and came to Louisville. It'll be 100 years ago in June of 2021. When I was 7 years old on Sunday, I'd make rounds with my father at Jewish Hospital. He was one of the first cardiologists in America. I had a draft number of 5 in Louisville, and that was the height of the Korean War. And if you didn't make grades, you were a private in the Yalu River Valley in North Korea. So I was smart, I made good grades. I got into medical school at the end of my junior year in college. It wasn't the science of medicine, it was the taking care of the patient and the humanistic side of medicine that really influenced my thinking. Here I am, almost 60 years later, still practicing cardiology. I'm still full-time. I have an office practice of patients, a cadre of patients, many of whom I've taken care of 20, 30 years. Today, I looked at the ages of the patients I saw this morning in the office. It was a 94, 90, 91, 88, 83. Somebody age 53 slipped in there. But these are patients that have coronary disease, chest pain, angina, hypertension, and they're in and out of heart failure and various cardiac rhythm disturbances. I know I don't cure anybody, but I want their last decades to be as anxiety-free as possible. And that's the way I practice medicine. And I let them know when I know they're really sick. I always give them hope and try just, so when they leave the office, they're not anxious and depressed. In 1967, I got drafted when President Johnson drafted 870 doctors on Christmas Day. On New Year's Day, I'm crawling on my belly in the Texas desert with a full backpack and 30 and 50 caliber machine gun bullets going over my head in an obstacle course. They put me in charge of a small hospital near Williamsburg, Virginia. I didn't have to go to Vietnam. I wasn't a surgeon, I wasn't a primary care. So that's what I did. I got lucky. I woke up, I was about, 38 years old, about 40, and I suddenly realized that I was just going to be a boring middle-aged doctor. I did not want to go to any more what I call docktail parties, not cocktail parties, but docktail parties. I went to the Speed Museum to hear a lecture, and it was on Roman history. Picked up a brochure. I called the fellow, I said, his name was Leonard, Al Leonard. I said, Professor Leonard, you don't know me. I'm a doctor in Louisville. I can afford my ticket. This dig is in Sicily, and I love history. I want to do archaeology. He says, well, if you can afford it, I'll take a chance on you. So I went to Sicily, and I did 15 years after that in classical archaeology all around the Mediterranean. I studied how they took care of patients and what medicine was like in those periods of time. And the bottom line is, there's no difference. We just have some different kinds of medicine. I have collected over 30 years disinfected mail, letters that got disinfected various ways dating back. My earliest letter that I have is about 1605, but this was during cholera and plague epidemics, mainly in Europe. That has interested me. I learned a lot about various epidemics along the way. It fit in with my medicine, and it fit in with my archaeology, and it fit in with my interest in history.